Health Academy, learning solutions for health professionals.
So welcome everybody. This is a slightly new thing we're trying. It's the first one of our new format of Lunchtime Health News. So we've been doing these sessions or Lunchtime Health News for a while now, and you can catch up on any of those recordings on the Health Academy webpage if you want at any point. But normally what we do is we have somebody speaking about something they're passionate about. They show you some slides, answer a few questions at the end if there's time, and usually there isn't, and then everybody goes, and then the feedback we get is, oh, we didn't get enough time for questions. So we thought, well, let's do something a bit different. So this is thank you for joining us on this experiment. We've decided to do an interview format with experts. And our first one is one of the loveliest ones, is Laura Kennedy there. And we're doing this on weight loss injections. And the next one we're going to do is on menopause. But I'll tell you more about that towards the end. So I'm Alice. You might have met me on some Health Academy courses before. I am not an expert in this subject at all. So I'm dead excited about hearing more myself. And most importantly, we've got the lovely Laura Kennedy there waiting to tell you all about weight loss injections. She's a leading nurse who's been instrumental in developing pharmacy-led weight management services and PGDs, which are used across the private sector now. And she'll be giving us especially an insight into the private sector here, which I think is, there'll be a mixture in this group of people from NHS and private, but I think it's always useful to know what goes on in other worlds. And so if you are in the NHS at the moment and you join because of that, it will probably be very interesting to hear that side of things. And now you can ask questions in the chat box. We have gathered some that have been pre-submitted. We've had an influx of questions which we've tried to integrate into this interview format. So we will hopefully have addressed those questions that have come in the background. If you have any extra ones, you can put them in the chat box. We'll probably address them towards the end, though, I think, unless it's particularly pertinent to something that Laura's discussing at the time. I'm so sorry, the cat's decided to join. If you can hear her meowing in the background, she gets very jealous when I'm not giving her attention. So thank you for those if you've submitted a question. And of course, this is a recorded session too. So if you need to leave or bits of it you miss or anything, you can watch it again afterwards. That's fine. And if you are watching from the future, hello. Just bear in mind that today's talk might be different in a month's time. Things change in medical world. So we're going to unpack what is happening with weight loss injections in the UK, what's fact, what's hype, what healthcare professionals need to know. And that's what we're going to be doing. I've just had a notification saying the host has spotlighted your video for everybody. Oh, I'm not sure what's going on there, but I've spotlighted now. I think Laura should be spotlighted.
Yes, spotlighted together.
So Laura, can you?
Hello.
Hello. Thanks so much for joining. I know it's nerve-wracking when there's lots of people here, and you're brilliant. You're going to be amazing. So can you tell us a bit about your background and what drew you to this area of practice in the first place?
Yes, of course. Thank you for having me. It's lovely. It's a lot of pressure to be the first person that's going to be doing this, but obviously I will do anything for Health Academy and Alice, so I'm happy to be here. Obviously, my background is I'm a nurse by trade, so I've been a nurse for about 20 years now, and my background has mainly been based around immunisations, but over the kind of recent years, I've been included in creating PGDs and also helping pharmacists a lot with travel health, immunisations, and then obviously weight loss. And I was asked to write the PGDs for the weight loss injections, and realised that I knew very, very little about weight loss injections. So thought, oh, do you know what? I'm going to do some training to find out a bit more about this, and realised there wasn't any training out there. So I have also created my own training package that I have delivered either virtually, face-to-face, online, because I say the majority of people that I teach are pharmacists that are venturing into the world of weight loss injections. So that's kind of how, and I've been to conferences, I've stood up at big conferences and given talks about weight loss injections. And we really encourage pharmacists, but we want to make sure it's a safe practice. And we don't particularly want people buying these injections online. So we encourage pharmacists to see these patients face to face. But that's kind of how I got into weight loss injections.
You spotted a gap and jumped in there. I love that about you. You're very entrepreneurial and you've done this with a lot of things. I love it. And I think it's a really important thing to raise that training across the board is perhaps not there and people are getting things in bits and pieces. And I love that you're putting that together for people and curating that knowledge into a training. Nice one. This is what I adore you so much. Okay, so anyway, let's have a look at the current context and look at some key facts and things, because there might be people in this group who've never even thought about weight loss injections before. I think I'm probably one of them myself as well, you know. So tell us, there's lots of media buzz. I'm seeing it all the time on Facebook and things like that about weight loss injections. What is the reality right now in the UK? What is a weight loss injection and what does it actually do? And what options are there for people?
Yeah, it's a lot. There's various kind of options out there. Obviously, originally we had kind of the oral medications that we would supply, but kind of came with side effects because it stopped you absorbing fat. So then people experiences quite not nice side effects with that. And now obviously we have the ones that people are talking about, the Manjaro, the Wegovy, and they're actually, you know, originally were created for diabetic patients to stabilize patients' blood sugars, but also have those weight loss benefits as well. And it's actually quite fascinating how these injections work in various ways. A lot of the time with patients that are obese or overweight, they have what we call food noise. So they constantly think about food all of the time and binge eat, etc. So the benefits of these weight loss injections not only keep food in your stomach longer, so they make you feel full up for longer, but they also quieten down the food noise. So they don't tend to think about food as much as they did previously. And sometimes that takes quite a while to get to that point because we still want to get enjoyment from food, but we just have to do it in a more kind of organized way. And we don't want to lose that enjoyment. And sometimes we have to be very careful you don't quieten down that food noise so much that you then don't want to eat at all. So it's quite a fine line by doing that. But the basics of it is yes, keeps food in your stomach longer, so keeps you full up for longer, maintains your blood sugar, especially with Manjaro, and just quietens down that food noise. So yeah, it's very clever how it works.
It's interesting, isn't it? I'd hate to be put off Cadbury's though. Oh, I don't think I could cope. And I think it's interesting what you said as well, that these are drugs that previously have had, these are unintended benefits of a previous drug for other diseases. Now, we did have a lot of questions about the use of these drugs for other diseases like diabetes, and that's not really the focus of today, is it? We're focusing on weight loss injections. So before those questions start coming in about how do you use it with diabetes, you know, that's a slightly different topic, and we've only got time really to focus on weight loss. But thank you for that. That's a good insight into why people might go for these and what they do. So just to ask you about eligibility, and from my understanding, there's slight differences in eligibility between private and NHS. So could you talk us through eligibility criteria, please?
Yeah. So with the NHS, obviously there's restrictions, and because I don't work in the NHS, I have to be very careful that I don't give kind of inclusion criterias because I'm not a prescriber and I'm not a GP that can make those clinical decisions. But as far as I know, because obviously, you know, there are some patients that will be prescribed this based on their diabetes, but also obese patients. But there is a strict criteria on the NHS because these injections are expensive, so we can't just kind of divvy them out to everybody. So the information that I got when I searched online, because obviously I specialise in private, is patients that from an NHS perspective, they have to be over the age of 18 with a BMI of 40 or above, or slightly lower if they come from Black, Asian minorities because they tend to have more cardiac health conditions, etc. But they also must have 4 other conditions such as high cholesterol, high blood pressure, etc. So it's quite a strict criteria. Apparently, they are going to change that over the next few years. From a private perspective, obviously, we have a lot more flexibility. So we can offer it for patients from the age of 18 onwards who have a BMI of 27 or above and at least one weight-related comorbidity, so high blood pressure, high cholesterol, etc. And also, one of the criteria in the PGDs from a private perspective is that they have failed to achieve weight loss via the routine way, you know, through diet control, exercise, etc. So we do reiterate with weight loss injections in the private sector that it's not something you just jump straight into. You have to have tried doing your own kind of changes to your lifestyle first before we jump into using weight loss injections. So yeah, that's the difference between NHS and private. Private, we have a bit more flexibility because obviously people are paying for the service. So a bit like travel health, we have more flexibility in the private world. So yeah.
Yeah, I think that's a really important point as well that you made about, making sure people have tried other methods first. It's so important rather than thinking there's that magic bullet of a medication that can come and cure all your problems, and perhaps being a bit blindsided to things like side effects, which we will get onto later on. But yeah, no, that's a good description of the eligibility there. So um, let's talk about some barriers then, because you mentioned that there's a bit more flexibility in the private world. What are, would you say, the main barriers to equitable access or safe prescribing as well, when it comes to weight loss injections?
Yeah, obviously price, and they had to put the price, they have put the price of Mounjaro up, so people are now switching to Wegovy or an alternative weight loss injection, which comes with its own, advice that we give with people that switch from one injection to another. They have to have what we call a washout period, so they have to wait 7 days, and then they restart or they start on the new medication, but they have to start at the bottom dose and titrate their doses up again. So it's basically kind of starting from the beginning again. So price is probably, a big kind of barrier that we see. And the main barriers obviously fit in the criteria. And I think sometimes, people think this, like you said, it's the golden bullet, it's the quick fix that people want. And I know I was saying this to you the other day, but I think it's really sad now that we're living in a society where everybody's slim because so many people are on weight loss injections when actually it isn't just about being skinny, it's about being or slim, it's about being healthy and making sure you've got a healthy BMI, because we do have to be very careful with weight loss injections that we stop when patients start to reach an unhealthy BMI. So the other kind of barrier I see, and this is something that the Pharmacy Association are trying to stop, is people purchasing these injections online without being seen, whether virtually or face to face. I've heard stories of bulimic patients who should be not eligible for weight loss injections, putting bricks in their pockets and taking photos of the scales that looks like they weigh a certain weight, and nobody actually assessing these patients face to face. So to me, that's the other risk factor. I would say we have to be very careful that we're giving these injections for the right reasons for the right people, but I think they are trying to put a stop to that. So we should be having those face-to-face consultations with these weight loss injections.
Yeah, it definitely sounds like a really important area for sure.
Yeah.
There's a lot of discussions. I think COVID brought up a lot about online consultations and things like that as well, which every area of medical practice kind of had to reevaluate. Can we do this online? Can we, and now it's kind of gone to the other extreme where it's so much online that we don't see anyone anymore.
No,
There's definitely
but you don't
benefit.
even know, you don't, sorry, but you don't even know what you're buying online. I watched a program quite recently of a lady that died after taking her weight loss injections and they tested, the MHRA tested what were in those injections and it had rat poison in it. I think because people are so desperate sometimes to have that solution that they'll do anything to get that solution. And, it shouldn't be like that. It's an important drug that we need to make sure that we are giving the right way to the right people. But yeah, I agree with you.
And I think you've touched on it already, that there's that wider social pressure of seeing people who, are slim, and that image people portray on TikTok and Facebook, and everybody's always on these things and wanting to be slimmer or prettier, or certain body parts be bigger or smaller. I mean, it's
Yeah,
just
it's true.
it's tough, isn't it? There's a much
It is
wider
tough.
context that this fits
Yeah.
in. Yeah, so I suppose this leads us on to the next question quite nicely, but are there any common misconceptions among professionals or the public that you would like to clear up now? I think you've already touched on this a bit.
Yeah, I mean, I suppose the biggest misconception is that it is going to be that quick fix. And I think, part of if you do get these injections the correct way via your pharmacy, the recommendation is that you are seen regularly, you should have your BMI checked regularly, your height, weight, your waist circumference, but you should make sure, or the pharmacist should make sure, not only that you are on these weight loss injections, but also that you are following a plan. That because I get quite passionate when I talk about this, but generally, a lot of the time, patients that are obese, it's not because they want to be, it's because sometimes, when we look at, when I created my training, we looked at what causes obesity, and people assume it's just people overeating, but there's lots of reasons. It can be hereditary, it can be that people can't afford to eat healthy anymore. Healthy food is really expensive. It's sometimes cheaper to get a quick meal from McDonald's than it is to buy kind of fruit and veg from Tesco's. So, a lot of it is about education. Yes, it's great that we have these injections. Obesity costs the NHS a huge amount of money every year, and we worry about, cancers, heart disease, etc. But we also have to educate our patients about how to eat well, what sort of exercise do we need? And there's so many great resources out there of, posters, leaflets, etc., that actually explain to people, using the traffic light tool when we look on our packets of food that we buy, trying to educate people. So I think it's important that, yes, it's great that you're on the injections, but you also need to make your own lifestyle choices as well. And I've spoken to a lot of pharmacists who have set up WhatsApp groups, and they invite patients to share with each other, techniques that they've learned, but also to support each other, because we can't just rely on the injections, because at some point you're going to have to stop and life will have to carry on, and you still need to make sure that you can still maintain your weight. So yeah, I think that to me is a big misconception.
Yeah, absolutely. It's starting to make me think maybe this is something we should be discussing in schools and stuff, starting early. And I know you're a big
Well,
the IMS situation as well, being educated in school about health promotion from an
yeah.
early.
Yeah,
Mm.
I mean, there is a lot the government are doing, when we see those sugar tax levies that we're putting on, Coca-Cola, etc. Now, part of that is to try and reduce obesity, not putting chocolate bars at the till just before, to make that quick purchase before you buy your whatever it is you're buying. Getting rid of buy one, get one free offers, because it's encouraging people to, potentially overeat. Not having adverts on at a set amount of time in the evening, because, you see an advert for Uber Eats and you think, oh, that looks quite nice. Maybe I'll order them. They are trying to make those adjustments, because, when we talk about vaccines, it's about trying to take pressures off of the NHS. So we need to, change people's kind of attitude around food. But it's hard, because there's many reasons why patients are obese. So yeah, it's health
Yeah.
promotion prevention is the way forward, definitely.
Yeah, yeah, gosh, what a complex. Every time you dive into a subject, it just gets deeper and deeper, doesn't it?
Does.
I find this with everything we do.
I know.
Get practical for a bit and have a look at prescribing considerations and clinical practice itself. So, are there any particular red flags, contraindications, or monitoring points we should keep in mind for patients who are starting this class of medication? Like, how would you follow up any issues and things, that kind of
Yeah.
thing?
I mean, there is strict, obviously, criteria. Again, talking about this from a private perspective, but there are quite a large amount of patients who won't be eligible, because pancreatitis is a big risk factor with these injections. So if they've had problems with that before, chronic kidney disease, there are quite a few, or patients that have eating disorders. With regards to side effects, especially the common side effects, nausea, diarrhea, hair loss. So we should be giving advice when we give these injections that, to eat little and often, to not snack throughout the day, but to make sure you don't get too hungry, because that can cause your nausea to be worse. Sometimes eating bland foods rather than, sometimes people might think, oh, it's great, I'm on these injections now, I can eat what I want, and it doesn't matter. If you try and carry on eating what you want, it's going to make you feel really nauseous. And actually, the MHRA, I mean, the most up-to-date information that I have, because obviously these injections are black triangles, so we need to make sure that we are reporting side effects, etc. And as of the 28th of October last year, they received 7,228 reports of the common side effects of nausea, diarrhea, etc. And 68 of those patients ended up in hospital. And there has been, not that recently, relatively recently, a nurse that died from the complications of taking these weight loss injections. We also saw in the news more recently around patients that were getting pregnant whilst they were taking weight loss injections. So specifically with Mounjaro, it does say, I mean, obviously, if we get nausea, diarrhea, and vomiting, that can affect the absorption of the pill. But actually, when we had a look at the SPC, the summary product characteristics of Mounjaro, it actually says that it can stop the absorption of the contraceptive pill. So we should be advising barrier methods as well for those patients. So it is quite complex, that's why when people just buy it online, I don't think they realise the risks associated with that, but also the advice that we should be giving, as well as giving them the injections. So, they are going to suffer those potential common side effects, especially every time they titrate up a dose. So it's making sure patients understand the reality of what it's going to be like. It might not be plain sailing. So to make sure we can give them that advice.
Yeah, I know one of my friends had it and had a really bad experience on it. She was ill, really unwell, and she stopped it now, but it
Yeah.
lasted quite a while as well.
Yeah, it
The
can
thing,
do.
it doesn't
Yeah.
just stop immediately, does it?
No.
So in terms of managing patient requests and things, how do you approach patients who come in requesting weight loss injections after seeing it online but might not meet those clinical criteria? I
Yeah.
imagine they get a bit disappointed in those situations.
Definitely, yeah. It is disappointing, but I suppose what our first conversation should be is, what have you tried already? Have you tried kind of following some kind of healthy eating plan, exercise plan, etc.? That would always be our first port of call. And there are NHS kind of weight loss programs out there as well. We have to again fit a criteria, but there is a set amount of a weekly program that you can follow. You have access to apps and support, etc. So there are other options out there. I don't know if they still do it, but I know GP surgeries sometimes would kind of recommend you could join up for Slimming World, reduce gym memberships, etc. So it is difficult, but if you've got a chronic condition, that means you're not eligible for this injection, it's going to be quite disheartening. So I think it's important that we offer patients the alternatives, because there are lots of like I say, so many leaflets, resources. The British Obesity Society offers loads of information. The British Heart Foundation website offers lots of information and tools. So there is a lot of support out there. It's just making sure we're guiding patients in the right direction.
Yeah, and not just saying a flat out no, go
Exactly.
away, but like
Exactly.
going deeper into it and going, well, why are you here in the first place?
Yes,
And let's sort
exactly.
that out. Yeah, giving people hope that there's other ways, which of course there are.
Yes.
So one thing this occurred to me as well. Also, I'm based in the private sector myself, and sometimes there's difficulties when it comes to liaisons with NHS services in terms of what you've given a patient, what you've started them on, and then there's always that. I know in travel health we have the whole one of us doing the MMR, the other one doing the yellow fever, and then they should be a month apart and all of that. So my question is about continuity of care here and record keeping. What if a patient starts treatment privately? Um, how do you manage that between NHS and private? Do you encourage them to go and report this to their doctors, for instance?
Yeah, so when a pharmacist starts a patient privately on this medication, they do let their GP, they are supposed to let their GP know. But I have spoken to a GP quite recently who actually signs our PGDs, who also works in the NHS as well as private, and says in reality, they're probably not going to have time to have a lot to do with those patients that are on that medication. And I suppose kind of the feeling is, if the patient has paid for that service, then that service should be followed up by their GP. But I suppose the time we have to be cautious with that is if you've got a patient who is diabetic and is on metformin, diet controlled, but doesn't fit any more criteria to be able to have that via the NHS, they can have it privately. We just have to make sure that the patient needs to know where to be followed up, and kind of, what symptoms should they be looking out for if they start to become unwell. And if they do start to become unwell, who is that person that they should go to. But yes, pharmacies, if you purchase these injections privately, you should still be liaising with your GP so they can have a record and can follow you up if necessary. But I know in reality, with the pressures of the NHS, it doesn't always work like that, unfortunately. But that is the recommendation.
And then we've got those centralized systems like yellow card reporting as well, haven't we? Which as well should be
Yes,
encouraged for people to report centrally if something happens.
definitely. Yeah.
So let's go back to holistic support, because I'm very much getting the vibe that this is about holistic care. So beyond the injection itself, what are the absolute minimum standards for lifestyle support, like diet, exercise, psychological needs that should be provided alongside a prescription? And how can busy primary care or pharmacy teams effectively integrate that with other services and the rest of the MDT?
Um, I mean, really, like I say, the recommendation from a private perspective is when the patient is started on these injections, they should then ideally, for the first 4 weeks, be seen face to face, but obviously face to face can be a video call, just to have a regular check-in to make sure that, patient is coping well, is not having too many side effects. If they are having side effects, what advice can the pharmacist give? Also making sure, like I've said already, that they're following a healthy eating plan, they're following an exercise plan, etc. And we do regularly have a look at to see how much weight that patient is losing. And after 12 weeks, if they haven't lost 5% of their body weight, then the conversation is, do we continue with the injection that we're using? Should we switch to an alternative because that is an option? Or is it the fact that the patient's really struggling with the side effects, etc. So maybe they need to maintain at that dose, or it could be that they need to stop completely. So yeah, we should be having regular check-ins, especially in that first 4 weeks. That should be weekly. After that has happened, then it should be monthly. We should be doing monthly check-ins. So sometimes people wonder why it's more expensive to buy these injections via a pharmacy than doing it online. That's because you should get that support behind it. So you should have that continued support from your prescriber. So that is the expectation when you're following a private PGD. That is the expectation.
Yes, I wonder, that's the thing, maybe people don't realise, they just think they can buy stuff, and why is it so expensive? We get this in travel health too, don't we?
Yeah,
Just go and have my
definitely.
yellow fever jab, and they don't think about all the conversations around it that you need to have as well, and that's what you're paying for.
Yeah.
Sorry, I know I keep applying it back to travel health. I'm still applying it back to a subject I actually know about, and there's a
That's all
lot of
right.
similarities here. It's interesting.
Yeah.
So, you mentioned about the long-term reviews and stuff, and looking out for things along the way. So let's focus on that point as well about long-term safety. Like, how long can you be on weight loss injections, and what are some of the issues with long-term
Yeah, I
safety?
mean it's a good question. Originally, there was a set time frame, but now the statistics that they're looking at is because there's so many health benefits to being on the weight loss injections, there is no real kind of long-term, we don't know long-term effects because, for a weight loss perspective, it's relatively new. And as you said, the MHRA are always looking at that information. But we have known, patients be on it for 2 years and tolerate it well. Everybody's different. I suppose the most important thing, we have to be careful that they still remain within a healthy BMI. And also the other thing is, maybe titrate down so they're on the lowest dose, because sometimes if you just stop taking it, you can struggle with that. So we can titrate it back down. But there is really no length of time that we know of that patients can stay on these injections for. So as long as they can tolerate it for, as long as it's still working, as long as they're still within a healthy kind of BMI. As soon as they start to come out of that healthy BMI range, obviously we would advise patients to stop taking it. But yeah, I've known patients that have stayed on that maintenance dose for a long period of time. But for me, the way I look at it is it should be used as a temporary measure. It should be used to get you on that stepping stone, to change your lifestyle habits, to change your diet, your exercise, etc. We shouldn't be relying on it forever because we don't know the risks associated with that. So for me personally, I think it's fantastic, but I think we have to be realistic, and it's expensive, so not everybody's going to be able to afford it for a long period of time. So to
Yeah.
me, it's something that's going to help you make those changes and kind of get you into eating healthier, moving more, etc. But yeah, there is really no set time of how long patients can stay on it.
Yeah, and I like that point. So it's an aid along the way with a goal at the end of it that really means that they shouldn't have to be on it if they're doing everything else correctly.
Exactly.
And they're getting into new habits and patterns, but it'll help them along the way. Interesting. So is there any other? So you mentioned that there actually isn't much long-term data in terms of safety. Is there any other gaps in the guidance or the evidence that you think clinicians might be struggling with at the moment?
Um,
One of the
Gaps
main.
in current evidence. I mean, obviously we have nice guidelines that we have to follow. So I think one thing I looked, because I'm very much about following guidelines, competencies, that's very much something that we talk about, making sure everything we do is safe. There are some lovely, nice guidelines out there about, what we should follow if we are prescribing people medication. And I think the biggest gap is education. I used to say this even before weight loss injections came out, when we used to talk about weight loss surgeries, gastric sleeves, etc. It's great, but does it teach that person how to manage their weight? I watched, there's a girl I follow on TikTok, actually, a very young girl, was only 24, and she had a gastric sleeve, but nobody taught her how to, with regards to her diet, and she ended up with such severe vitamin deficiencies that she's actually lost the use, she's lost all sensation in both of her feet, and is now in rehab. And yes, it's great that we can take away bits of people's stomachs or give them weight loss injections, and they will lose weight because scientifically that's how these things work. But the education part is so important. We must be educating people about the correct way to, if you just say to someone, well, you just need to go on a diet, there's going to be people that don't know what that means. So we need to be making sure that we're giving them the right education information. As always, I'm so passionate about educating patients. We can't make the assumption that everybody knows how to lose weight. They don't. And that's why they're having to rely on these kind of, injections, procedures, etc., to help them. So we need to offer them that education. To me, that's the missing link, I always say.
Yeah, I agree. And just as you've been answering that, I've noticed in the chat box there's a couple of useful documents people have been posting. You've got a sea of co-hosts around you here. So
Great.
Philippa's posted the nice guidance that you've been mentioning, and she's
Brilliant.
said about the cohorts that are explained there as well. So thank you so much for that, Philippa. That's really nice. And also she's posted a national digital weight management program
That's
for
the one I
those
was
with
saying about.
diabetes. Yeah, I think
Yeah.
that was, yeah, it came in as you were talking about that.
Yeah.
Thank you,
Yeah.
Philippa. Join us on our next interview. If anybody knows about menopause, that's our next one. Please join and co-host for us. We'd be very grateful. Thank you. Keep those links coming. If anybody in this group has links that to put in, please do, because we're really grateful for that, aren't we, Laura? It's hard
Yes.
to post links and talk at the same time, so we
It
do appreciate
is. It is. And when I do my training, these are the things I talk about. I talk about what is available on the NHS versus what is available privately. If you fit the criteria on the NHS as part of the NHS weight program, but not everybody does. So you have to fit quite a strict criteria. So, but yes, there's definitely support on the NHS, but sometimes people have to rely on those private services as well.
Yeah, yeah. I might just skip the next question because it basically I think you've answered it already. So I don't want to make you repeat yourself. So let's talk about the future, and then we'll move to some question and answer because the time has just vanished. It's been very fast. You've said so many useful things. So the future of pharmacy. So given your expertise, where do you see the role of the community pharmacist or primary care evolving over the next 3 to 5 years regarding the provision of weight loss treatments and long-term patient support? Is there anything you can see from your crystal ball?
Yeah, yeah. I mean, I'll say I'm a great advocate for encouraging pharmacists to get involved in this service. Definitely, there's definitely many benefits, and we do have to look at this from a financial perspective as well. That NHS pharmacists really struggle now. They don't make a lot of money from NHS prescriptions, etc. So that's why I really encourage pharmacists to get involved in private services like travel health, like weight loss injections, like phlebotomy, like ear syringing, etc. Because from a not only a financial perspective, but getting footfall through that pharmacy as well, which is great. So I definitely think it's going to grow. The National Pharmacy Association are definitely changing the guidelines, so people won't be able to purchase these injections online as much anymore, which is great. There's going to be kind of more structure to it. So we're going to see more people attending their pharmacists to go and get their injections, which is brilliant. But also just want to quickly add in the health benefits of these injections. Yes, we know that obesity costs the NHS a lot of money. And yes, in the future, the more people that can lose weight via using services like weight loss injections, that's going to have an impact on obesity, which is brilliant. But they've also looked at the health benefits of using these weight loss injections. And it's quite interesting. There was I think it was from the Telegraph a few months ago, and they've had a look at patients that are taking it for a diabetes perspective, and they have found that it could potentially reduce the risk of 42 conditions, which is really interesting, like dementia, a lot of psychiatric conditions as well, not just kind of weight related conditions. So there's definitely going to be possibly, future benefits of this. And we find that a lot, don't we? When we look
Yeah.
at our Shingrix vaccine,
Right.
Shingrix
Yeah.
has added health benefits to it. So, again, although these injections are expensive from a private perspective, we have to look at the longer term benefits of it and, how much money we're going to save the NHS in the future, not just for obesity related illnesses, but other illnesses as well, which is definitely a positive, which is great.
Absolutely. I love a good unintended benefit. It's
So do
nice.
I.
Brilliant. Okay, thank you for giving us a glimpse into the future there as well. Now is the point. If anybody does want to ask any specific questions, please do feel free to pop them in the chat box. We had most of the questions we had pre-submitted, I integrated into the questions there. So I hope your question's been answered if you were one of those. There is another one that wasn't in the original batch. It says, I have several, and again, I just want to reinforce that this isn't about other diseases as such, but let's see what you can do with this one. I have several diabetics who are obese and have been prescribed a GLP-1 by GPs, but are only on one diabetic drug, for example, metformin. Should we be going to GLP-1 as second add-on rather than, for example, the SGLT2s, then GLP-1? I mean, to me, that's like speaking another language. And I think it does border into other realms, but
Yeah. I
what-
think again, we just have to make sure that we follow the NICE guidelines, and follow obviously the prescriber who's making that clinical decision. I had a look because obviously I get to see the questions in advance because I was quite interested about this question as well. And what it does say is we can use these injections alongside metformin, because when we look at this from a private perspective, originally we used to say that if patients were on any medication for diabetes, we couldn't offer them the PGD. There was far too many complications because they can end up with diabetic retinopathy. That is one of the side effects of taking the weight loss injections alongside being diabetic. Also, it can sometimes mess up your sugars slightly because obviously you're changing your eating habits. And we were concerned that pharmacists wouldn't be able to look after those patients in a more complex kind of cases. But that has been adjusted now, so we can offer weight loss injections privately to patients who are on metformin. But again, we just need to make sure they understand the risks associated with that. But we can use it alongside metformin. When you look at the NICE guidelines, it does say that we can kind of add it in alongside metformin. But I don't want to give any more because I'm not an expert, definitely, when it comes to diabetes.
It would have to be an individual decision as well on a risk
Yes.
assessment, wouldn't it? Like with anything,
Yes.
the prescriber's responsibility is there. You've
Yes.
actually got a question. When you mentioned diabetic retinopathy, there is a question from somebody in the chat box at the moment about people who have severe eye disease. And I'm wondering if that's related to that, what you said about
Could
retinopathy.
be. Yeah, it could be. I mean, I'm just going to have a quick look at the our what's the word I'm trying to think of, our PGD with regards to so all it says is patients who have diabetic retinopathy should be used with caution in these patients with appropriate monitoring. So we just, again, these medications are relatively new, so we just have to make sure that it's safe, and it could be for some patients it's a caution, it's not a contraindication, but we just need to make sure these patients are being monitored. And again, make sure the patients, because one of the things that I have conversations with pharmacists about is, making sure that patients understand the risk versus the benefits. Yes, obviously you're going to lose weight, but let's have a look at your chronic conditions. And we have to, it's like anything, isn't it? We're weighing up the risk versus the benefit. Is the benefit going to outweigh the risks or is it not? And that's the clinical decision that, as clinicians, when we're working under PGDs, these are kind of the conversations that we need to be having with our patients. And it's a fine line. It's a difficult decision to make sometimes. That's okay. You're welcome.
And have they tried something else first is the other question,
Exactly.
isn't it? That's
What
the other
have you
thing.
tried already? Yeah. When you look at the
Yeah.
inclusion, when you look at the inclusion criteria on the PGD, one thing it will say is, what have they failed? Let's make sure they failed at other routes first before we
Yeah.
go down the route of using weight loss injections.
Yeah, it's a good point. And then I think you did answer this earlier, but Nicola's just asking, do patients need to wean off once they have lost the weight, or can they just stop taking them? I think
The
you mentioned titration
recommendation,
before.
yeah, the recommendation is ideally to lower down the doses before you wean yourself off of it. Because what can happen is, if you just stop taking it, sometimes the weight can come back on relatively quickly. But everybody's different. Again, there's no strict guidelines around that. But ideally, we should reduce the doses before somebody stops. So take it back down to your lowest dose, because that's how we work with weight loss injections. Obviously, there's different maintenance doses depending on what injection you're taking. You titrate yourself up those doses, and then once you reach the weight that you'd like to achieve, then we can take that back down before you stop taking them completely. And like I said originally, right at the beginning, we want people to still enjoy food. We have to be very, very careful that we don't quieten down that food noise so much that patients have no appetite whatsoever. And I've heard some situations where patients literally are eating an apple a day, because they just have no appetite whatsoever. I also hear other horror stories where, because people are so desperate to lose weight, rather than following the titration process, they jump straight up to the highest dose because they feel like that's going to help them achieve that weight loss as quickly as possible, and then suffer serious side effects with that. So again, it really reiterates why we want to get pharmacists involved. We want patients to have face-to-face consultations so they can have those conversations and they can ask those questions. And one thing we haven't spoken about today, but they have to self-administer these injections as well, which is a potential barrier for some patients. So yeah, that's the advice that we give.
Yeah, I'd love to talk to you more about the self-administration side of it, because I'm sure there's a lot of people in this group as well who talk about, insulin self-administrations there, B12s comes up a lot there too. And that's a whole new topic. Maybe that's another topic for us sometime, just to talk about educating patients there. But yeah, it's another thing, isn't it? I mean, we've got 2 minutes left. So I was going to ask you, my last question was going to be a key takeaway, but I think you kind of did a really good summary there already. And so that was going to be the question. But yeah, if there's in 30 seconds, one key takeaway that about the UK approach at the minute you want people to take from this session, what would it be? I don't think I can see any of the questions in the chat box.
Yeah, I mean, my key takeaway message is always going to be education. Always, making sure that we give patients all of the information they need to be able to make an informed choice. Because the problem is, and we see this a lot with vaccinations, people make decisions based on what they see on social media. Like we've said, people might see celebrities that have had these injections and suddenly, look amazing in their eyes and they want to look like that. I think we just have to make sure that not only are we realistic with the patient and make sure that they understand the risks that there are. You could end up with pancreatitis, you could end up severely dehydrated where you end up being admitted to hospital. So yes, there's definitely health benefits, but there's also risks associated with these injections, and make sure that they are taking their own measures as well, as so they're not relying solely on the injections themselves, and making sure we consistently monitor those patients as well. And but yeah, definitely education is always going to be the thing that I get very passionate about.
I know. You're brilliant as well. You really are. Anyway, we've come to the end now. So thank you so much, Laura. I feel so much more informed. I'm sure the audience does too. Please give Laura your feedback in the chat box briefly, but we're also going to give you a feedback form to give us some feedback. I think she did great. Let us know. Also, just a reminder that you can watch the replay of this on the YouTube channel. I think, just keeping an eye on this chat box, yes, the feedback form is in the thing. I think, Michelle, are you also going to pop the YouTube channel link in? That would be great. And remember, we've got another, oh, look at all these lovely things floating from the we have got the next Lunchtime Health News session, which is with and Alex Fryer that I'm interviewing on the 20th of November, and that will be at 12:30. Please do sign up and submit your questions in advance if you have anything specific about menopause next. Another subject I'm going to learn a lot myself on,
I'm
I
going
think.
to join that one, I think.
There's some lovely comments in the chat box. Thank you so much,
you.
everybody, because it is nerve-wracking for people doing interviews in front of many, many people. I think Laura's a natural there. But yeah, go and enjoy your lunch if lunch is next, or your clinics if you've got clinics running. Thank you so much, everybody. We'll see you on the next one, I hope.
Thank you.
Oh, thanks, Laura. Thank you.